In health news, October marks Menopause Awareness Month. Now, it used to be taboo to talk about menopause, but nowadays, women are becoming more vocal about this biological milestone and what they're going through. And a new survey shows that the menopause stigma can even impede women's career growth. According to Bonafide, a women's healthcare company, 80% of women say managing symptoms at work is a challenge, with nearly 3/4 of them saying that they feel uncomfortable or self-conscious at work when they have a symptom like brain fog. So let's talk about menopause with Dr. Sonal Haerter with Dignity Health Medical Group. Sonal, great to have you. Always a hot topic. So we can't talk about menopause without talking about perimenopause, which comes first. So talk about the difference between the two.
By the way, did you know there's a movie coming out called The M Factor, and it's all about menopause? So that's like one of the biggest things. Most women are looking forward to this movie because it talks all about it.
Wow.
But going back to your question, so perimenopause is a transitional phase before menopause. And we know that menopause equals no periods consecutively for 12 months around the age of 50, 51, or in your late 40s. And so 5 to 10 years prior to that is perimenopause. So that's the proper definition of menopause and perimenopause.
So that can even, I mean, you could be looking at perimenopause as early as 40.
Or late 30s even.
Whoa.
And this is something that a lot of women are unaware of. So depending upon when you attain menopause, just 5 to 10 years prior to that is all perimenopause.
Wow. Okay, let's talk about the symptoms. Like we just mentioned, earlier brain fog, how embarrassing that could be. I mean, you think, okay, we've gone through, what is it, mommy mush brain, momnesia, whatever. And then now comes this. I mean, there's symptoms. They're just ongoing.
Absolutely. And this is all the effect of lack of estrogen or declining estrogen, progesterone, the female hormones. So you have sleep issues, so insomnia or waking up in the middle of the night and not able to go back to sleep. Mood changes, depression, anxiety, new onset of anxiety that women have not experienced before, irregular periods. It's part of perimenopause, not so much menopause, because menopause you should not have any periods. And if you do have any spotting, that's a point of concern. That's when you have to see your doctor. But perimenopause, you can have heavy or light periods. You go months without periods. Also hair and skin changes. Weight gain is very, very common. Problems with cholesterol issues. So these are very common. One more, palpitations. And I remember this interview with Oprah, and she actually figured out it was menopause and perimenopause. But palpitations is a very, very common symptom during perimenopause.
Oh, wow. Okay, so what can we do?
So hot flashes are something that most women commonly seek treatment for. We always hear about hormonal therapy, which is great for hot flashes, and you should ask about it to your doctor. But there are some other things like proper nutrition, regular exercise, maintaining your weight at optimal weight. These things can actually reduce some of these symptoms. Connections, spending time with your family, nature walk, these are things that are within our control. But also for mood changes, you can have antidepressants, anxiety medications, sometimes even sleep aid to get through it. 15% women actually get evidence-based treatment for these symptoms. So it's a very small number. So talking to your doctor about your symptoms and seeking treatments for some of these symptoms, that can impact quality of your life.
Yeah, something new I just learned as well. Menopause. Apparently women, we are not the only ones who go through this stage in life. There's something called menopause that affects men later on, and we're going to talk about that. Actually, Troy's going to talk about that next Monday.
Awesome.
When you come back.
I cannot wait to talk about it.
Troy, you ready?
Trim, I don't know.
Menopause. I joke about it, but it's a real thing.
Menopause so bad. All right.